assembly. He can talk about limits in orthodontic treatments and the techniques he uses to reach these limits. More than this orthodontist is coming right from Paris, France. I want to show you some pictures concerning Paris, the city where I live, the city where I work, and the city that I love. The definition of the limit is the point where the action stops. But in my point of view, in orthodontics, the limit can be the point where we can no longer go further in the treatment strategy. So, what are the limits in orthodontic treatments, and where are these limits? When you are on a highway, you have a speed limit, and you don't want to exceed this speed limit. Otherwise, there's danger, and when you exceed the limit, you have excess speed on motorway. What about the limits in our orthodontic treatments? I'll show you two kinds of cases, the teen orthodontic cases and the adult orthodontic cases. And in the adult orthodontic cases, you'll see ortho-implant cases, which will interest you, and orthosurgical cases. The teen orthodontic cases. The first case is the case with classical limits. It's a classical case. This boy came to my office for an orthodontic treatment. As you see, he has a flat profile, very thin lips. And when we look inside the mouth, he has important crowding, bilateral class 1, deviation of anterior midlines, important crowding on both arches, and the panorex shows lack of place for upper canines, especially on the left side. The cephalometric X-ray tells us we cannot do an important expansion. So I decided to treat this case without extractions. I waited until the evolution of upper and lower premolars and began my orthodontic treatment with fixed appliance. Intraoral occlusal photographies, and these are photographies of one stage of the treatment. I've already placed the upper right canine and trying to place the upper left one. We still have an important deviation of anterior midlines. As you see, the lower arch is finished, already finished. These are final photographies with bilateral class 1, alignment on both arches, and correction of the shifted midlines. Intraoral occlusal photographies show good alignment on both arches. And when we compare before and after, we can see we made light expansion, but a controlled expansion in order to avoid extractions in that case. The final photographies, extraoral photographies, show us a nice smile, but what's interesting is to see to compare before and after. And when we look to the profile photographies, we can see that our orthodontic treatment didn't have any negative effect on the profile of this young boy. Still in the teen orthodontic cases, in the next case, I pushed the limit. I pushed the limit because this girl came to my office with a class 3 profile. She has a concave middle stage of the face with a class 3 smile, and intraoral photographies show us a complete anterior crossbite with important deviation of midlines, class 3 on one side, crowding on the upper arch. When I see the Ceph, she has a real class 3, skeletal class 3, and I ask myself, do I have to treat this case with or without surgery? Is it surgical or not? I decided to avoid surgery and decided to treat that case with extractions. I extracted upper second premolars and lower first premolars. These are final intraoral photographies with correction of midlines, anterior crossbite, and bilateral class 1. Occlusal photographies show us alignment on both arches, and these photographies are shown to let you see the stability of the case 2.5 years after the end of the active treatment. What's interesting in that case is to see the smile, sure, of the patient. She has a good smile, a nice smile. But what's very interesting is to see before and after on the profile. She doesn't have the same profile at the end of the treatment. She doesn't have a class 3 profile. There were an improvement on the face, on lateral photographies, and improvement on the smile too. And these are final smile photographies of this patient. When you arrive to adult orthodontic treatment, it's not the same point of view. The first case is an ortho implant case where there were no limits. This guy came to my office, this man came to my office for an orthodontic treatment just to improve his smile. He wasn't satisfied of his smile. And as you see, he has a flat profile. Intraoral photographies show anterior severe overbite, class 2, division 2. He has 2 on upper arch and missing tooth, the second right bicuspid. He has a light crowding on lower arch. I decided to treat this case without extractions and decided to prepare the place for a future implant. He didn't want labial fixed appliances, and I treated him with lingual appliance. Here are occlusal photographies on one stage of the treatment, and these are final intraoral photographies with the implant placed already. We have corrected the crowding on both arches, the class 2, anterior overbite, and the midlines too. These are occlusal photographies, and these are final intraoral photographies with the prosthetic crown and the stability of the case too. When we look to extraoral photographies, we can see that when we look before and after, we can see that we have corrected the smile. That's what he wanted when he came to my office. And extraoral photographies show us a nice smile. I think I met the patient's request. Thank you for choosing Philadelphia. I love this city. Very, very nice, very beautiful city. Another adult orthodontic case is an ortho implant case. In that case, I pushed the limit too. This woman came to my office with a real class 3, which could be a surgical case. She has anterior complete crossbite, missing teeth on lower arch, extrusion of upper molars and premolars. She had very, very thin roots on incisors. I decided to treat her without surgery. And these are final intraoral photographies with the correction of anterior crossbite, intrusion of upper molars and premolars, mesialization of lower right molar. She has a nice smile and was very happy. I saw her I want you to see, what's interesting is to see the profile improvement before and after. And as you see, she doesn't have at all the same class 3 profile at the end of the treatment without any surgery. I saw her 4.5 years after the end of the treatment, and she was very stable with all implants and prosthetic crowns, and these are final occlusal photographies. Yesterday, Dr. Eduardo Messen showed us 10 years stability case. This is a 4 or 5 years stability case. And when we compare before and after, we can see the work that has been done. She has a very nice smile. She was very happy. Another adult orthodontic case is an ortho implant case. And in that case, I pushed the limit too. And you'll see why. Because this woman came to my office to improve her smile. She wasn't happy of her black triangles and the proclination of her incisors. Intraoral photographies show us a full class 2 on one side, important overjet, overbite. And when I saw her, these are occlusal photographies with a crowding on lower arch 2. When I saw her x-rays, I saw a weak perio and a real severe skeletal class 2. I had to be honest with her, as usual with all my patients, and I told her that it was impossible to treat her case without surgery. She didn't want any fixed appliance. She wanted neither a labial one nor a lingual one. So I decided to treat her with aligners. I use Invisalign technique, but you can use what you want. As Dr. Lieberman said 2 days ago, why can't you use new modern tools like computers, like Invisalign, scanners, etc. These are intraoral photographies after the preparation of the 2 arches. We have corrected the overbite, overjet. We have corrected the alignment on both arches, as you see on these occlusal photographies. And she was ready at this stage for the surgical jump. Unfortunately, she didn't want surgery. She decided to stop and to stay with this smile. She was very happy. I wasn't very satisfied, but. So this result, we obtained this result only with aligners, Have we reached the limit of the system? This is a question I ask myself, ask you too. Next case is an adult orthodontic case, which is an orthosurgical case treated without extractions. Here I push the limit too. You'll see why. Because this patient came to my office for an orthodontic treatment. She has a class 3 profile, class 3 smile, and same pattern, middle stage, concave middle stage of the face. And she has an end-on-end occlusion on anterior side, anterior occlusion, end-on-end occlusion, crossbite on one side, a real class 3. Occlusal photographies show us a light crowding on both arches, making the case more difficult because we cannot extract and she doesn't want surgery. The Ceph show us a real class 3, skeletal class 3, and the impossibility to procline more than this upper and lower canine incisors. So it was impossible to procline and impossible to make surgery, impossible to extract. She didn't want fixed appliance too. I treated her with Invisalign aligners, and these are final photographies with the correction of anterior midlines, shifted midlines, correction of end-on-end occlusion, a correction of the crossbite. Occlusal photographies show a nice alignment on both arches, and this class 3, which were initially a surgical case, has been treated, as you see on these photographies, before and after, without surgery, and only with aligners. Once again, only with aligners. What's interesting is to see her nice smile. She's very happy, but the facial improvement on the profile. As you see, before and after, she doesn't have the same profile. She doesn't have, at the end of the treatment, a class 3 profile. The last case is an adult orthodontic case that I treated with extractions. When he came to my office, in that case, I pushed the limit too. When he came to my office, this man knew very well what he wants. He said, I don't want surgery. I don't want fixed appliance. I just want to align my teeth and improve my smile. So, as you imagine, I have to treat him with aligners. Intraoral photographies show a full class 2 on one side, important crowding on both arches, important overbite and overjet on one side. Occlusal photographies show us crowding on both arches. And he didn't want surgery. He didn't want fixed appliance. I decided this is the Panorex with wisdom teeth, and the cephalometric X-ray with the real class 2, skeletal class 2. I decided to treat this case without surgery and with extractions on upper arch. I decided to extract first premolars and decided no extractions on lower arch. These are final intraoral photographies with the correction of the class 2 canine, correction of anterior overbite, and these are occlusal photographies with the alignment on both arches. When we compare before and after, we can see the work that has been done, because this man doesn't have the same pattern of his arches. The final extraoral photographies show us a nice smile, and I think once again I met the patient's request. I didn't make surgery, I didn't make fixed appliance, I just made 2 extractions. As a conclusion, I think we have, as orthodontists, to ask ourselves always, try to find the answers concerning the questions concerning what are the limits in orthodontic treatments and where are these limits, and can we reach these limits and can we push these limits. At the beginning of my lecture, I show you pictures of Paris. I want you to see this picture. This picture is the south of France, represents the south of France, a place called Côte d'Azur. You have in front of you a small village called Saint-Tropez. It is a small part of paradise, and on this picture, I want to thank you for your attention.